So chapter 13, part 2, the first thing that we're going to start with is concussions. A concussion is defined as a brain injury that is caused by a blow to the head or body, a fall, or another injury that jars or shakes the brain inside of the skull. When I was growing up, it was thought to be where someone actually had to lose consciousness in order to have a concussion. Well, through research, we have learned that you do not have to pass out in order to be having a concussion. All right, so here's another video for you. This video does a good job of showing the jarring or the shaking of the helmet as it was so forceful that it came flying off. So with this video, it was first thought that he might have had a spinal cord injury, but thankfully he only ended up having a concussion. All right, so there are different grades of concussion, and this depends upon the symptoms that the person is showing or demonstrating, and as well as how long those symptoms last. So concussions are graded as grade 1 is mild, grade 2 is moderate, and grade 3 is severe. And this is depending on such factors as loss of consciousness, the type of symptoms, and how long they last, like I had already spoken about. So grade 1 concussion, symptoms last for less than 15 minutes and there is no loss of consciousness. Grade 2, no loss of consciousness, but symptoms are going to last longer than 15 minutes. And then grade 3, a person loses consciousness. And this doesn't matter if it's just for a few seconds or for a few minutes. If that person is losing consciousness, then it is automatically a grade 3 concussion. Now, some of you may have already suffered a concussion. It could be through sports, it could be through other activities. Not all of these symptoms are going to be for everybody. Some concussions affect people differently. Some of the common areas that we can see symptoms appear are in their thinking and remembering, their physical abilities, their emotions and their mood, and as well as their sleep. So thinking and remembering, you're not thinking clearly, you might feel slowed down, you're not being able to concentrate, not being able to remember new information. So when I was doing athletic training in college, one of the tests that we did was the 3-word test. You pick 3 words and you give them to them, and then in a few minutes you ask them to repeat those words in that order. So the words could be like flower, diamond, and rainbow. So you ask them, what were those 3 words that I gave you? If they can rally them off, really quickly, no hesitation, in the correct order, then that's a good sign that they don't have a concussion. If they can't even remember that they heard 3 words or that you told them to remember 3 words, then that's not a good sign. All right, so physical, some people report headaches, have fuzzy or blurry vision, nausea and vomiting is very common, could have dizziness, sensitivity to light or noise. They could have balance problems or feel like they are, leaning one way or falling, and then feeling tired or having no energy. Emotional and mood, easily upset or angered, sad, nervous, or anxious, and more emotional than usual. When we had a football player, he had a concussion during a football game, and he was the most mild-mannered person, always very polite. But after he got this concussion, he was not very nice, to put it the nice way. He would cuss at us, he would try and hit things. His mood just completely changed until his brain had a chance to heal, and then his mild nature came back. Sleep. sleeping more than usual, sleeping less than usual, or having a hard time falling asleep. So definitely sleep can be interrupted. Now, when somebody has a concussion, are they allowed to go to sleep? A lot of times people will answer no, and that is no longer the case. Now they say yes, they can go to sleep, but you have to have somebody with them that can check on them, like every hour, every 2 to 3 hours. That is just to make sure that they can still be woken up and they are still responsive. So if someone does have a concussion and they're not being able to be responsive or being woken up, then they need to go to the emergency room. If you can wake them up and they still, know where they are and things like that, then they can go back to sleep. All right, so now that we talked about all these injuries, now we're going to talk about how to treat them. So treating less severe injuries, these are the ones that you may have to go to the doctor for, or you may not have to, depending upon the severity of them. So initial treatment of exercise-related injuries, your objectives are this. First thing, you want to decrease pain. You never want to try and increase pain to an injured site. You want to try and limit swelling, and then you also want to prevent further injury. We have this acronym called RICE, which stands for Rest, Ice, Compression, and Elevation. Sometimes you might hear it as PRICE, and the P would stand for protection, which that could be, by wearing a brace or wearing a boot or something like that. So rest, say we have a sprained ankle, how are we going to rest it? Well, of course, you can stay off of it. You can sit in a chair or sit on a couch. But if you have to get around, what can we do? One of the common ways is to wear or to use crutches or possibly use one of those scooters. Ice is pretty much self-explanatory. You're going to ice the area. As far as compression goes, you may wear a compression sleeve, or you might use like an ACE wrap or something like that. And then as far as elevation goes, you just want to make sure that the injured area is elevated, and that's going to help with the swelling. All right, so rehab, increasing use as pain lessens. So some injuries are going to just have natural rehab, and what we mean by that is just by natural use. Other ones you're going to have to do actual exercises in order for it to get back to its normal functioning. So minor injury rehab occurs naturally. Definitely you're going to have drawbacks. Sometimes it's going to be slow progress. Sometimes you may get re-injured by doing some of this rehab. That just happens. A lack of more aggressive treatment may prevent return of full functioning. Sometimes injuries are so severe that no matter how much work you do, it's not ever going to be the way that it was before that part got injured. Going back to like a sprained ankle, some of the things that we did in the athletic training room to do rehab, you see the picture of the person using the bands. That was a common one. We also had sponges that they would have to balance on. We did marbles where you would take a pile of marbles from one side of your foot. Using your toes, you would grab one and move it over to the other side, and then you'd go back. We would do ABCs in the cold whirlpool, and then we would also do the scrunching of the towel, which you would scrunch the towel with your toes and move it back towards your heel. All right, we've got this thing called cryokinetics. It is definitely a rehab technique. Now it is used pretty much all over the world. It's basically a regimen of alternating ice with light exercise. So what you would do initially, you would ice the area for 12 minutes. Then you would do light exercises for 3 minutes. If you have increase of pain, you repeat RICE, you rest for 24 hours, and then you come back the next day. If there is no increase in pain, you would ice for 3 minutes, and then you would go back to light exercise for 3 minutes. The goal is to get through 5 cycles of light exercise and ice without any increase of pain. All right, so preventing unintentional injuries. Unintentional injuries are the #1 killer of people ages 15 to 34 in the United States. Risk factors for unintentional injury are the following. First one, having an unsafe attitude. Second, being overly confident, it won't happen to me. A lot of times with people in this age group, 15, even sometimes younger, up to 34, they have this idea that they're invincible, that, they're a good person, no matter what they do, they've got a long life ahead of them. And sometimes they don't realize that, what they are doing is putting themselves at risk. Craving excitement and thrill seeking, these are those adrenaline junkies always wanting to try to push the limits. Use of alcohol and drugs, that can also be a risk for unintentional injury because they alter your perception and they may give you false impressions in your mind, or they might slow down your central nervous system to the point where you're not able to react to things. Stress, again, that can alter your perception. You may be so stressed out that you're not really thinking straight, or you might be distracted in situations. And then for environmental factors, just making sure that you're using equipment properly, making sure that you're using products the appropriate way. Don't use it for something that it's not made to be used for. All right, so looking at this chart, unintentional injury is the number one killer, like we just said. The biggest one is motor vehicle crashes. That is so big. I don't know if any of you have had the unfortunate thing of having that happen to you or knowing people that has that happened to, but in my 4 years of high school, we had somebody pass away 3 of the 4 years due to a motor vehicle crash. And I only graduated with 142 people. So my school was not that big. And to have that happen 3 of the 4 years was a big deal. Poisoning is the next one, and then drowning. And then other, that could be from, just any other types of accidental injuries or deaths. If you look at the 15 to 24 age group, homicide, suicide, malignant neoplasms, that's cancer, and then heart disease is the remaining 5. 25 to 34, excuse me, you got malignant neoplasms, and then heart disease increases up to 3, and then suicide and then homicide round out the top 5. But like I said, motor vehicle crashes is the number one for unintentional injuries. All right, hopefully some of you are first aid and CPR certified. It's always a good thing to have because emergency situations don't always take place at the hospital. A lot of them will take place in homes and outside in social areas. So the first thing that we're going to talk about is choking. So when someone is choking, like the lady in the picture, she's giving the universal sign for choking, usually 2 hands up to the throat. With CPR and first aid, biggest thing that you need to be aware of is permission in certain situations. So for example, the lady, she's giving you the universal sign, she's still upright and she is still coherent. First thing that you must do is get permission to help her. So you could go up to her and say, hey, look, are you choking? Are you okay? And she could nod yes. And then you could say, you're choking. Can I help you? I know what to do. And she could say no. So if she says no, then you cannot touch her because then it could be assault. Even though she doesn't need help, until she becomes unconscious, then you can help her if she says no, she does not want your help. We've got the thing called abdominal thrusts, and that's the Heimlich maneuver. And I'm going to show you a video on how to do that in just a little bit. When it comes to certain populations, like pregnant ladies or infants, you cannot do a normal abdominal thrust or the Heimlich maneuver. So in the picture with a lady, if somebody is pregnant, you want to put your hands above the baby bump, wherever that is. Some women carry very high, some women carry very low, but you want to put it above the baby bump. Otherwise, you're going to be pushing in on the baby. You could hurt the baby. Also, you're not going to be able to be moving as much air in order to help dislodge that. For infants, you're going to do chest thrusts and back thrusts in order to helpfully dislodge whatever they would be choking on. All right, so the 2-person Heimlich maneuver, In A, you've got the person is conscious and choking. If the person is coughing, that means that they are still moving air, and you want to encourage them to keep coughing. Once they stop coughing, then they are fully choking and you need to step in. So if you can see the person's hands, you're going to go in between the belly button and the xylophoid process. Somewhere in between there, you put your hands. And then when someone becomes unconscious, unfortunately, you have to change positions. Your hand position is still going to be the same. Now, when you go up to somebody and they are choking, you don't want to go up there flat-footed, because if they were to get unconscious, they're either going to fall forward or they're going to fall backwards. And if you're not prepared for that, you could fall too. You could either fall on top of them or they could fall on top of you and you could get hurt. So when you go up to them, you want to straddle your legs, have maybe the right foot in front of the left. That way, if they do become unconscious, you can help lower them down to the ground in order to prevent them from hurting themselves and you as well from getting hurt. All right, so here's this video.
I'm Brianna, and today we are going to discuss the things that you need to know if you find a person choking. This is Choking Charlie. He's going to help me with the demonstration. The universal sign for choking is the hands crossed at the neck. If they are coughing, then they are able to breathe, and you would not perform the Heimlich maneuver on them. In order to do this, you stand behind the person and make a fist with your thumb pointing back against you, midline between the belly button and the rib cage. Grasp that fist with your other hand and pull back and up quickly until the object is expelled or the person loses consciousness and needs to be lowered to the ground to begin CPR.
So the Heimlich maneuver, if you are ever by yourself and you start to choke, the worst thing that you can do is panic, because if you are fully choking and you cannot move air, when you panic, you are going to use up your reserve. So the best thing that you can try to do is stay calm. And I know that's easier said than done. So what you want to do, you want to find some type of object. It could be a chair, it could be a desk, it could be an end table, something where you can lean over and force that object into your abdominal area up and in. So you have something that you can basically throw yourself on or use in order to make that Heimlich maneuver motion. Hopefully, that could happen and help dislodge that object. Always, always call 911 if you are starting to choke, and you're not able to dislodge it. Get somebody there as quickly as you can. Even if you cannot talk, they can track on your cell phone your location and they can get somebody there in order to help you. All right, more unintentional injuries, poisoning. In the hospital, especially during springtime, we see all kinds of unintentional poisonings by people mixing cleaning solutions that should not be mixed in a small area, particularly the bathroom. You definitely want to check the label for key information. Always know what you're mixing, what you're using together. Never, ever mix chemicals unless you know what you're doing. For a poison or a potential poisonous material or liquid, the skull and crossbones is the identifiable label. A lot of times on products, they will have a Poison Control Center number on it, and they will also have the manufacturer's number on it. So if you say, hey, look, I need to mix this, however, I can no longer read all of the label, you can call the manufacturer and say, I'm trying to mix, this product for this type of use. I need help. And they will help you and tell you how to mix it appropriately so you don't harm yourself. All right, with bleeding. You definitely should lie the person down or at least have the person sit down simply because a lot of times people don't necessarily react very well to seeing blood, whether it be their own or someone else's. So definitely have them sit down or lie down. That way, if they do pass out, they're not going to get hurt. Step two, you want to remove any dirt or debris from the wound. And I'm not talking about like a hook sticking out of someone's foot or a stick in somebody's ankle. I'm talking about like splinters or little pebbles. You know, if it's just a little bit of dirt or debris, definitely you can remove that stuff. You want to apply pressure until bleeding stops. The thing with bleeding is once you wrap that wound up, you don't want to keep checking on it to make sure that it's not bleeding anymore. Because every time that you remove that bandage, you could be removing the scab that had been forming, and then the whole process starts over. Depending upon how bad the wound is, it may need stitches, it may not. So if there's any question, you know, always go to the emergency room or urgent care and they can take it from there. Now, the big thing with bleeding is also impalements, and a fish hook or a stick or something like that would be classified as an impalement. With impalements, you never, ever, ever want to remove the object. Anybody tell me why? I wish we were in class so we could, but simply because if you remove that object and it has hit like an artery, and you remove that object, you may be causing that person to bleed to death. So never remove objects. Let the hospital personnel do that, because if it were to bleed, they should have the staff in order to help that person so they don't bleed out. We had a guy, he was running through the woods just last year, and he jumped over a log and he fell onto a stick, and he came in with a stick through his ankle. He was very fortunate. It didn't hit any bones or anything like that. It had just went through the soft tissue of the area. But they do happen, so you have to be careful and be knowledgeable with those. With bleeding as well, you know, never try to remove the impalement object, but you also want to try and keep it steady so it's not moving back and forth or, you know, shaking, causing more damage to the area as well if you can. All right, stop breathing or stopped heart rate. You definitely want to call 911 immediately. Even if the person is unresponsive, call 911 immediately. You don't know, you know, what they are on, if they fell or what's going on. So definitely call 911 immediately. Each year there are approximately 360,000 cardiac arrests outside of hospitals. AEDs definitely have increased that survival rate up to 75%. An AED is an automatic external defibrillator, and you can find these pretty much anywhere in hospitals, schools, gyms, malls, airports. They are pretty much everywhere now, which is wonderful because it is definitely helping increase the survival rates for people who do have cardiac issues. With CPR, you know, even if you have never done CPR before, if you do call 911 and you are comfortable performing it, they will walk you through the process. The bad thing with situations like this is people, you know, sometimes don't want to get involved because they are afraid that they could either hurt somebody, not knowing how to do things, or they're fearful of being sued. So we have this thing called the Good Samaritan Law, and that is basically covering you if your intentions are to truly help somebody. So if you do come across a situation and you are doing CPR and you break somebody's ribs, which is very common, they cannot come back and sue you because you are actually trying to help them in that situation. You are trying to save their life. So that would be covered under the Good Samaritan Law. All right, reducing your risk of unintentional injury. Here are some other ones. Some of these you may be looking at and be like, oh my goodness, this is common sense. But like I have told you before, some people do not have common sense all the time. So wearing a bicycle or motorcycle helmet. Simple enough, right? So you always want to wear a helmet and use reflectors and protective clothing when riding. I cannot tell you how many times we have had people come in either mountain biking or more so on motorcycles, especially down here when it's warm, that we've had people, in shorts and t-shirts riding motorcycles and they have to lay their bike down. And they come in with incredible road rash. I mean, all up and down their legs and arms, on their face. And what people don't realize is that when those areas get cleaned out at the hospital, it's not a very pleasant process. They are going to use a debridement sponge. And it's not soft like a washcloth. It's, kind of jagged in that in order for them to get into areas and to remove any pebbles, any other type of debris in those areas. So it's a very unpleasant experience. Not to mention, after you get done at the hospital, you have to go and shower, and that is very painful too. So if you're using a motorcycle, definitely wear the protective clothing no matter what the temperature is outside. For the mountain bikers, definitely you want to use the bike paths that you are comfortable with and you are capable of doing. Don't try to do ones that are out of your comfort zone. For falls, maintain ladders and steps in good working condition. Use skid-proof backing on rugs and use handrails or non-slip mats in the bathtub or shower. Two different things. Ladders are definitely a major cause of injury that we see. Just saw one yesterday, in fact. But the one story that always comes to mind when people are talking about ladders. When you are using ladders, you never ever want to use them by yourself. You always want to have somebody there that is capable of holding the ladder for you and to help you in any type of situation. Well, one November, this guy, he was going to put Christmas lights up on his house. So he was up on his roof. Well, somehow the ladder fell. Didn't have his phone with him. He sat there for a few hours, got impatient, and decided he was going to get down off of his roof no matter what it took. So he jumped. And this was not a single-story house. This was a double-story house. So when he jumped, he landed straight down and broke both of his ankles. So not a good decision at all. Now, if he would have had somebody, there with him, they could have put the ladder back up and he could have gotten down on the ladder rather than jumping. So always have somebody with you. With showers and bathtubs, I don't know how many times we've seen people, slipping, getting in or out of the shower. Either that or as they're getting out, if the tile or the linoleum is wet on the other side, just falling and getting hurt. So just definitely want to be careful. As far as drownings go, never allow children to swim unsupervised. A lot of times with drownings, unfortunately, at your guys' age, comes from having the idea that, wearing a life jacket is not cool. Not everybody in your classes are going to know how to swim. And a lot of times that insecurities of what people will think of you fogs your decision on to wear one or not, even if you're going to be out in the water, for a little while. So if you do not know how to swim or do not know how to swim very well, definitely wear a life jacket. If you're in a pool, make sure that you're staying in the shallow end where you can touch. Don't go into the deep end, regardless of whatever the reason is. Just use your common sense and make sure you're protecting yourself. With people that are going to the lake, why do you think it's important for you to tell a person specifically what area you're going to? Say, okay, well, I'm going to go to Carter's Lake. That's not specific enough. The reason is that if something were to happen to you, say you said that you're going to be home at 5 o'clock and here it is 8 o'clock and they cannot get a hold of you, then they know where to start looking. If you say, hey, look, I'm going to Carter's Lake, I'm going to, boat ramp 5, okay? Or I'm going to beach area 1. At least then they have an idea of where to go and look for you. Otherwise, they're wasting a lot of time driving around the entire lake trying to find you. So definitely be more specific if you're going to the lake so people can be aware of where you're supposed to be. Poisoning, we kind of talked about. Big thing, other than cleaning solutions, is also medications. If you're on more than one medication, make sure you talk to your pharmacist and say, look, these are the medications that I'm on. Can I take them together? Do I need to split them apart? That way they can make sure that, you're not accidentally poisoning yourself and you can still take the medications that you are needing. With fire, the acronym is PASS for the fire extinguisher. First thing is that you want to pull the pin. You want to aim the fire extinguisher at the base of the fire. You want to squeeze the handle. And then lastly, you want to sweep the area. With fire extinguishers, it is very important for you to know what type of fires that fire extinguisher is good for. Some of them are good for anything. Other ones are only good for certain ones. So before trying to put out a fire, make sure that you are aware of what one yours works for. Also, you need to make sure that your fire extinguisher is still within the expiratory range. Fire extinguishers do expire, so you want to make sure that yours is still good. For motor vehicle crashes, do not drive when you're overly tired or sleepy. Sometimes that is worse than driving when somebody is intoxicated. Also, you want to maintain your vehicle in good mechanical condition. Make sure you're getting the tires rotated. Make sure you're getting the brakes when you need it. Make sure that you're getting the oil changes. Make sure that you are taking care of your vehicle that you're supposed to. If you need assistance or if you're in an accident or something like that, try to stay in your car if all possible. If you are in an accident and it starts to smoke, then get out of it. But otherwise, try to stay in it, simply because sometimes people are distracted and they want to see what's going on. And sometimes they don't always maintain their lane. And they could, go into your area. And at least if you're in your car, you are protected to a sense, rather than just standing out there and possibly having somebody come by and hit you. All right, so question 1 for this one, match up the following. You have grade 1, grade 2, and grade 3. Remember, these are your concussions. So which one corresponds to which? So grade 1, symptoms last less than 15 minutes and no loss of consciousness. Grade 2, symptoms last more than 15 minutes and no loss of consciousness. And grade 3 simply is loss of consciousness. Remember, again, that doesn't matter if it's for a few seconds or for a few minutes. All right, RICE stands for blank ice compression and elevation. So what does the R stand for? It stands for rest. What is the leading cause of death among young adults? We got homicide, unintentional injury, suicide, and illness. Answer is unintentional injury. Specifically, it is motor vehicle crashes. It has the most. When someone is bleeding, you want to do all the following except which? Lie the person down, remove dirt and debris, apply pressure to bleeding site, remove bandages once they are saturated. So like I said during the lecture, you do not want to remove bandages once they are saturated, because you could accidentally remove the clot that has already started to form. If they are becoming saturated, just add more bandages on top of it. All right, and that is it. So for Wednesday, when your class time is going to start, check your email and I will send out the test code for you to enter into Top Hat. For those of you that do not have ASO specifications or accommodations, you will have the normal 50 minutes to take your test. And then for those of you that do have ASO testing accommodations, you will have an hour and a half to take the test. There will be multiple choice, true, false, and maybe one short answer. I may change that in order to do more multiple choice and true false. Just be prepared for those 3 types of questions. However, you may only see 2. I hope all of you are doing well, staying safe during this unprecedented time with this virus. Please make sure that you are following all those safety measures that the CDC has recommended. You know, seeing firsthand the effects that this virus has, whether they be old or young, it's definitely not something that I hope any of you ever have to deal with. So please make sure you're taking care of yourself and your family. If you have any questions, just let me know. I'm here to help. Have a good day.